Mental health touches everyone in countless ways, but too often, the people most affected are left out of the conversation. To move forward, advocates agree that we need to listen differently, ask deeper questions, and make mental health personal.
A few years ago, the US Surgeon General, Dr. Vivek Murthy, declared youth mental health as a crisis and an epidemic within the United States.
Rates of anxiety and depression have steeply increased over the past few years, and right now, about 20% of youth ages 13 to 18 live with a mental health condition. That's 1 in 5.
This came probably not as a surprise to a lot of people who have been watching young generations feeling lonely, feeling anxious and confused, not least of all depressed and all these other things. So we are starting to see the consequences of generation upon generation of trauma and abuse and confusion and also just stigma build up and then explode at a time when information and technology is so available, and we're finally having these open conversations for the first time in many families' histories.
And this problem is so large that it means we need to reframe the question from what are youth doing wrong these days to how can we make our world better so that youth can see a future with themselves in it.
Mental health is just a normal human thing that we should be incorporating into our daily conversations. To feel is to be human, and there should be no shame or stigma in that.
Experts agree that awareness isn't enough. When we reframe global mental health as a justice issue, we turn stigma into support and shame into advocacy. Behind every statistic is a story. And behind every story, the chance to heal.
We need to shift our approach to mental health from fixing people to really addressing what makes us feel broken. It means providing people with community-led solutions, and that also means building up people from the ground and investing in the next generation of people who are able to advocate for health for their communities. It is not our job to swoop in and save people. Honestly, they have the strength and the resilience within themselves. What we need to do is to support them and provide them with the tools to do so.
The youths of today grew up with new concerns that old ideas were not designed to accommodate. We've gone from a few decades ago barely having a computer to now having AI that can basically replace us. We're navigating all of this at such a fast speed that nobody knows how to deal with it, much less the people growing up who haven't had that chance to cement who they are yet. I want you to think about what connection meant to you when you were a child. Did that look like going to a playground and playing with someone? Or maybe grabbing lunch together at the school cafeteria before the bell tells you better hurry up and finish that sandwich? These are tactile things that we remember decades later because they have a place, time, space associated with it. And all of that nuance is lost when everything just becomes data bytes. And so that's why it's so important to facilitate that person-to-person connection in a very real human way.
A lot of the time, we hold back our emotions and our experiences because we feel like those are what make us different. But honestly, those struggles, those insecurities, that is what makes our story so powerful when we find the courage to share it. And even that can make a difference.
These ideas aren't just theory. They're being lived out every day by young people rewriting the story of mental health on their own terms. At Letters to Strangers, that story began with a letter, but it leads to something much bigger: community, resilience, and real-world impact.
Letters to Strangers is the largest global youth-for-youth mental health nonprofit, directly impacting over 500,000 young people in 72 countries over the last decade. We do this through everything from our namesake anonymous letter exchanges, but also with science-based education written entirely by peers with medical reviewers, and also grassroots advocacy and direct service provision.
If you'd like, you can submit a letter through our free online platform. This is how I found Letters to Strangers, actually. And the interesting thing is that it's not a pen pal system. Instead, we use a message in a bottle format, which means that you write your letter, it gets sent to a stranger, and you read a stranger's story in return without any pressure of having to respond in the right way or say the perfect thing.
Students often come up to us wanting to start a Letters to Strangers club. So sometimes it looks like they just want peer support. They want to feel seen and heard by others in their community. And so through that, we've exchanged over 60,000 letters. Sometimes what they need is educational support. We have done things like hold the first student mental health rally for the first time in years. We've brought in counselors for the first time. We've added mental health hotlines to ID cards, put posters in bathrooms, but those are just what you can see as like a tangible thing. What you don't see is the momentum this creates for people to talk about mental health within their communities. I started Letters to Strangers after my own diagnosis of bipolar disorder and later complex PTSD. These things shaped who I am, but at the same time, it also showed me what the human connection really means. How one letter, one human connection really can save a life. What we really hope is for a world where people are kinder and more empathetic to each other. If people want to get involved, they're welcome to visit our website, letterstostrangers.org. There's all sorts of information about how you can write a letter as just a member of the public or as part of a student club. We like to say at Letters to Strangers that there's this phrase, right? Hurt people, hurt people. But the follow-up to that, we believe, should be healed people, heal people.
Letters to Strangers, mental health made personal. To learn more and get involved, please visit letterstostrangers.org.